Princess Sheila Jane D. De Lajero, a student nurse from Davao Doctors College Incorporated. Today, I will be demonstrating the proper hand washing. Hand washing is the most effective way to prevent the spread of microorganisms. Through hand washing, we can reduce the risk of cross-contamination and risk of transmission of microorganisms to client. In hand washing, the equipment that will be used is antimicrobial liquid soap or regular bar soap. Towel can be paper towel or cloth. Lotion, which is optional, a sink with running water, and a trash can. Before proceeding to the actual procedure, we must check our hands for breaks in the skin, such as hangnails or cuts. Open cuts or wound can harbor high concentrations of microorganisms. Inspect the hands for heavy soiling, which can require longer hand washing. Also, inspect if your nails are short. Short nails are less likely to harbor microorganisms. Scratch a client or puncture gloves. Next is to remove the accessories in your wrist and hand, such as rings, during washing. Microorganisms can lodge in the settings of our jewelries that are not visible to our naked eye. In addition to that, removal of any jewelries facilitates proper cleansing. I'm all good, now moving on to the procedure. First, we stand in front of the sink while keeping our uniform away from touching the sink. The sink is considered as a contaminated area and our uniforms may carry organisms from place to place. Now turn on water and adjust force. Avoid splashing water onto uniform. Water splashed from the contaminated sink will contaminate our uniforms and microorganisms grow in moisture. So make sure that the force of the water is just enough to flow in your hands. Now, we wet the hands from wrist area, pointing fingers towards the bottom of the sink. Water should flow from least to most contaminated area. Note that always hold hands lower than the elbow so that the water will flow from the wrists to the fingertips, because wrist is considered cleaner than our hands. Now we apply a small amount of soap. For this, I'll be using a liquid soap, and we'll lather hands thoroughly by rubbing from palm to palm in a circular motion. Next, we perform all friction motion for at least 15 to 30 seconds. Friction and rubbing mechanically loosen and remove dirt and transient packing. This also ensures that all surfaces are cleansed. Now I'm going to rub the back of each hand over the other with fingers interlaced. So soap cleanses by emulsifying fat and oils. Also, it lowers the surface tension. Then, rubbing palm to palm with fingers also interlaced. Okay, so now I'm going to rub the back of my fingers of opposing palms with fingers interlocked, just like this. Then I'll perform a rotational rubbing of my right thumb using my left palm, and vice versa. Now I will clasp the fingers on my right hand and rubbing it on the palm of the opposite hand. Lastly, rub the wrists. Okay, so we're done. Now we rinse our hands and wrists thoroughly with running water to rinse the organisms and dirt into the sink. So rinsing mechanically washes the microorganism away. Inspect for remaining dirt or soap. So make sure to rinse properly. After rinsing, we dry our hands and wrists using a paper towel to prevent the skin from chapping. So we dry from cleanest to less clean to avoid contamination. And after using the paper towel, we discard the paper towel. I'm gonna take another one. Now we turn off the faucet with a new paper towel. So we must remember to avoid touching the handles with our hands. This will prevent us from picking up microorganisms from the faucet handles. And after that, we dispose it to the trash can. Lastly, inspect hands for signs of contamination. Inspecting will determine if hand washing is done enough. We're all good. I guess that is it. Now your hands are clean and safe.